Good morning, good afternoon, good evening to our global community of Kabuki patient families, researchers, partners, and friends. Today is a very special day because it's Kabuki Syndrome Awareness Day, and it couldn't be a more wonderful day to kick off an incredible day of programming, conference programming. I'm Annie Dean. I'm proudly wearing green today, and I'm a co-founder of the Kabuki Syndrome Foundation and proud to serve on the KSF board with an incredible team of board members, a next level executive director, Janet Lee, and a world-class medical advisory board. To every researcher that we heard from yesterday and will hear from today who has dedicated their career to Kabuki, thank you from the bottom of my heart as a parent. Yesterday, over 100 participants stayed with us throughout the day to hear deep dives on game-changing research from global institutions, learn about our patient advocates from across the world, and celebrate patient stories. And today we're going to hear about exciting programs and research coming out of places like the Roya Kabuki Initiative, and we'll also hear from our most beloved and most venerable experts, adults who are affected by Kabuki syndrome. And this community showed up yesterday. Over the past 2 days, we have raised $48,000, and $12,000 came from conference participants during the conference itself. Remember how impactful that is in the context of our 2-to-1 matching program. So thank you so much for the money that you've been able to contribute over the course of the day yesterday. If this conference is meaningful to you, please do consider supporting the Kabuki Syndrome Foundation. Everything you see here was made possible through volunteer efforts, as well as through the incredible support from our conference sponsors. We're working really hard to raise money to fund dedicated staff and to take advantage of the momentum that we are building in our global community to directly fund research and invest in critical collaborative elements, things like a shared virtual biorepository. Every dollar counts, and if you need help making a formal appeal or managing fundraising, please reach out to us through the website, in the Q&A, or the chat, and we will reach out to you directly to help you engage your community, family, and friends. So what I wanted to talk about as we kick off this morning is sort of our strategy at the Kabuki Syndrome Foundation, and give you some awareness of what we've been building behind the scenes for the past several years that are really all coming to fruition in an incredible way right now. And as I wrap up a short discussion of that strategy, I'll then introduce the incredible leaders of our Roya Kabuki Initiative, and you'll see a short video. So I'm somebody who's a business builder. I've built a startup. That startup was acquired. I've been in a bunch of different business areas. I'm somebody who's really deeply invested in kind of figuring out what the next space is. And when I think about what we're doing at the foundation and how we've come to our strategy, it's always about figuring out where's the biggest problem that we can uniquely solve. Where do we have sort of an unfair competitive advantage to be able to attack that problem? And when it comes to rare disease research, what we've learned is that it's all about creating collaboration, because there's so few of us across the world that are focused in this area. And in order for us to make impact, we need to engage all of our voices and all of our efforts to drive to the single mission, which is to make sure that we have research that drives treatment and hopefully someday a cure for Kabuki syndrome. So our ultimate goal at KSF is to develop a collaborative research network that involves strategic partnerships to pool resources, increase knowledge sharing, and accelerate research efforts. We're doing this in 2 key ways. First, we're focused on educating and informing. And next, we're focused on collaborating and activating research. When we think about what it means to educate and inform, we're really reviewing deeply the landscape of Kabuki syndrome research. And we're comparing that landscape to the priorities that we're identifying from you through things like the crowdsourcing survey that you see within the EventMobi conference platform at left. This is an opportunity to tell us about what matters to you and your family and your loved ones who are impacted by Kabuki syndrome. Where are you not getting enough support? Where do you need to know more? And by being able to understand that from you and connect that to the wider landscape of research activities that are happening across the globe, we can make sure that each of those issues is researched and uncovered. We also want to make sure that we're increasing access to diagnosis and care management. And we heard from many different partners over the course of yesterday that there are new technology platforms to help make this happen. And partnerships with companies like Allstripes have really helped us drive forward greater access and streamlining patient information to make it easy for us to go from institution to institution in the process of families buying diagnostic journeys. And we're working with other startups that have high potential to be able to support a faster path to diagnosis. We're making sure that we're staying current on research across the globe to make sure that you, our patient families, have easy access to all of the research that's being uncovered through our website. And if you look at the EventMobi platform at left, you will see something called research recruitment that will give you access to all of the current research, open research opportunities for you to participate in. We also are consulting on and advising the design of clinical trials. So we want to be that moment of collaboration where we know that researchers from around the world can come to us and we can help make sure that we represent the patient voice in the design of those trials. And finally, when we think about collaborating and activating research across the globe, this is all about making sure that we are investing in important infrastructure to make sure that different institutions are incentivized to collaborate, to have standardization in the way that we look at data, to have easy access to data so that researchers can all take advantage of the hard work that each group is doing independently. And that's an incredible opportunity for us as patient families and at KSF to make sure that we're driving impact. And then finally, and we talked about this just a moment ago, it's all about funding and making sure that we can mobilize and fund the best research in the world so that we can continue to advance therapeutic opportunities for our children and loved ones.